Hi, everybody. I'm Jocelyn Mamenta, and I'm here with Dr. Stephanie Arlis-Mayor, who specializes in family and sports medicine. And today the topic is concussions. We see this all the time during football games. Dr. Arlis-Mayor, what exactly should we be looking for when somebody comes off the field thinking they have a headache?
Most typically, concussions happen from kids having helmet to helmet in football or helmet to ground. The kid will feel dazed or stunned, and they'll come off the field, or you'll go out to the field to assess them. A good athletic trainer will first look to make sure that they have no neck injuries before anything else, and then they'll evaluate them for concussions. Athletic trainers often use something on the sidelines called a SCAT guide, which is the Sports Concussion Assessment Tool. And that asks a series of questions of the child and evaluates them neurologically on the sideline to see if they have any symptoms of concussion. The kinds of things the kid might complain about is headache, which is not very typical. Most commonly, they'll say they feel foggy, they feel off, they're not sure where they are. They'll have difficulty remembering things like the score, who scored the last touchdown, sometimes where they played the game before. They might remember where they are this time, but they might not remember where they played the game before. We also ask kids questions that we need to know the answers to. So I can't ask them what they had for breakfast because I don't know. And most commonly, kids will make it up if they're not sure. The other thing we look for with someone right off the field is a change in emotional behavior. Sometimes they get giddy and laugh a lot. Sometimes they get irritable. Changes of behaviors, things that you wouldn't expect normally. And those are the assessments that the athletic trainer will make on the sidelines to see if a kid has had a concussion.
As a parent, should we ask the question, is this what the procedure is for our football team when something like this happens? I mean, some football teams may not have somebody who is an expert in this.
Yeah, athletic trainers are usually trained in this. There are actually some wonderful guidelines on the CDC websites and some of the sports websites that allow them the specific questions they might ask. Most athletic trainers will have a tool. The physicians on the sidelines for football games will know how to ask these questions to make this assessment, and then they're the ones that have to decide whether the kid can or can't go back in the game.
How can you prevent something like this from happening?
Preventing concussions themselves are very difficult. Some people talk about changes of the rules. Helmets are obviously important. The most important thing about concussions is not necessarily preventing the concussion itself, but the symptoms of the concussion and returning to sport when the brain is still injured. Like any other muscle, you hurt your thigh, you're not going to go back and play while it's still hurting. The brain is also incredibly sensitive, and particularly so for adolescents. And so if we return them to sport before their brain is healed, then they have more chance of injuring their brain further and having longer symptoms. And that's what we really pay attention to as parents and as physicians, that we don't send a kid back into sport until their brain is healed.
When can they return? How do you know that the brain has been healed?
The most recent consensus group met in Zurich, which were the experts of all concussions, and decided that children 18 and under, if they suffer a concussion during a game, should not return to play that same day. Even if they're really fine 10 minutes later, if they've had a concussion, they should not return to play that same game. Afterwards, it's up to the athletic trainer, parent, and doctor to make decisions. No child should go back to sport if they have any symptoms from their concussion. Headache, fogginess, dizziness, imbalance.
So all of that has to be cleared?
All of that should be cleared. We also have a new tool that we've been using, which is neuropsychologic testing. Some people have heard this as the impact studies. Many high school teams test their kids before they start playing a sport to get a baseline. It's a computer-based test that evaluates ability to do mathematics and reading. It's a very involved computer-based test. You get a baseline, and if a child has a concussion, you repeatedly test them at specific intervals, and when that neurologic testing has gone back to normal, their baseline, then they can be cleared to return to play.
But a lot of these players feel a lot of pressure to get back into the game as quickly as possible. So what do you say to the coaches out there and parents as well?
That concussions are serious. The majority of concussions, children with concussions and adults with concussion, will resolve in 7 to 10 days spontaneously. But if not treated properly, they can be school-ending, career-ending, and potentially the worst-case scenario is life-ending. If a kid goes back or anybody goes back too soon and gets hit again, there's a potential that it could be detrimental to the point that they can't continue on. And it's not just a couple of points on their SATs that we're talking about. We're talking about people that can't finish out their school year because they've had such severe injuries. We're talking about athletes. Hockey, Patrice Bergeron is a classic example, 10 months before he could even get back on the ice because his head was injured so badly in a hit. And so it's very, very important to take it seriously.
In basic treatment for concussion, what would that be?
Rest. And it's not just body rest where you just kind of calm down, but it's actually mental rest. So when a kid has a significant concussion, you have to work with the schools to decrease their school load. When they're home, video games, texting, malls, all of those things are too much work. And so you need to bring them out of that situation to allow their brain to rest as well as their body.
Thank you very much.
Thank you.